Madam gave it its name actually. Sangam means confluence, coming together. The theme was past reflections, future projections. We had just come out of COVID, and we wanted to take stock of what we had done, particularly in Maharashtra, the focus being in Maharashtra. And the coming together of these two institutions, the state university, the only state health university I think in the country, and also IIT Bombay, which has more than 30 schools dedicated to looking at public health in various shapes and forms. And also the third pillar came the Takimi Fellows. Now, who are the Takimi Fellows? I'm joined here by quite a few of the fellows. This is a program that the Harvard T. Chang School runs, and it's a fellowship meant for working professionals, medical professionals who can go and be embedded in the university, and they can learn from the best, and they can take a data set and analyze it. And that opened our eyes. We are 22 in India. The largest Takimi presence is in Japan because it is funded by the Japanese Medical Association. At this point, I would like to just show a few snippets from what we have been doing, and you can see the photographs here. So Dr. Michael Reich, the man in the middle with the shawl, is the Professor Emeritus who launched this program 40 years ago, and he has just handed over to another professional, Dr. Aya Goto. She has just taken over. Yeah. So, these are the fellows. As you can see, these are the fellows. Dr. Gupta is here. Dr. Mishra is here. They all presented in the 40th anniversary in the Harvard University last October. And so one of the key components of Sangam is also that we felicitate our professors. We give them our thanks. We express our gratitude for the opportunities they have given us, for the learning they have provided us, and for the guidance they continue to give us. So we felicitated Dr. Michael Reich. You can see him here again, the salt pepper hair. And then we also felicitated Dr. Keizo Takimi, who is the son of Dr. Taro Takimi, who started this program more than 40 years ago with the Japanese Medical Association. He was the longest serving president of the Japanese Medical Association, Dr. Taro Takimi. And his son is currently the health minister in Japan. And this is kind of an international cross-border collaboration that we do. So Takimi is the third pillar in this Sangam, and what we hope to see, you can see here Dr. Keizo Takimi and Dr. Michael Reich when they spoke to us online last year for the felicitation. This year, the felicitation is to Dr. S.P. Subramaniam and Dr. Vishwanath. Since they are teaching at this moment, they are not able to join us in person. We'll be doing that felicitation whenever they come to Mumbai next. So what is it? Thank you. So what is it that we want this? So what is it that we do in Sangam? If you have not already got it, then I will just say it in a few words. It's a summit of academia networking with government, allied health workers and medical professionals. In India, government provides scale. So anybody who is keen to work on population level schemes and programs, I think a partnership with the local government is essential to make sure that all of those schemes, policies and benefits go to the people they are intended for. So this platform that we have formed together is a collaboration to bring together national and international experts, government officials and medical professionals. And that is why this year we have key themes of Indian medicine, Ayush. I think sometimes we don't talk enough about it. We have mental health as one very big component of our conference. We have vaccine development. India did develop vaccine, and we have Dr. Abhisar Puskar here with us, who's working on developing the Kala Azar medicine. One of the things that vaccine that we have forgotten there's Kala Azar in the country. And we also work on medical devices. There's a exhibition outside, and there's a human form, and you're supposed to go and put a post-it if you feel there is a medical device required for any one particular anatomical organ of that human form. And hopefully during this conference, we will find people who are willing to collaborate on those medical devices. Therefore, I would like to make a specific mention of Samir, which is a lab located here in IIT Bombay, a few minutes away from here in case you want to go visit it. And with Samir, Sangam would like to partner for designing and bringing commercially viable devices into the market. So it's no longer going to be Silicon Valley, my friends, it's going to be Sayadri Valley, which is going to be in Maharashtra. And so, what have we done? As Madam pointed out, what MUHS has done, I would like to point out what Takimi has done. Since Sangam 23, moving on to Sangam 24, where the tagline is One Health, we have found a partnership where we are very keen to roll out HPV vaccine for young girls, from ages 9 onward. That's something my friend and cohort mate Mika always used to talk about in Harvard, that why are Indian governments or Indian administration not rolling out HPV vaccine. So we found a donor, we have a partner organization, and this is something that we are going to roll out today. And in fact, in Sangam, these discussions are going to be finalized. In addition, we analyzed the 108 data, which is the emergency medical service that is provided in Maharashtra. I don't know if you've seen 108 ambulances going around, but we analyzed 10 years of that data with the help of Koita Foundation. We found another company called PHB, with whom we are now running AI and ML algorithms to look at what are the gap areas and what are the interventions that need to happen moving forward. And all these inputs have already been shared with the government, and we have been tasked now to come up with a draft in which the scheme can be improved in its entirety. The third area where we are working together is on heat. We are right now in the middle of a heat wave in Mumbai, unprecedented 40-degree temperatures, and then the wet bulb effect as well, where high humidity further enhances the impact of heat. So how are you going to manage heat moving forward? How are people going to go about their daily work if they are not comfortable and physically fit to do their work? So we are working on a mechanism with 3 local state government agencies, that is Thane, Mumbai, the entire BMC, and then Nagpur, and looking at what needs to happen, where are the gap areas, and what policies need to come forward so that you have more local approach to heat instead of just a one-size-fits-all kind of an approach. So these kind of research activities is what the Takimi Fellows contribute to, and we make sure that we partner with agencies and people who share a vision of trying to bring a change and trying to make a difference, and ultimately the goal is to save human lives. So this latest research also has led to some very interesting devices which have come in the market. I don't know how many of you are aware, we have Dozy. Dozy is a very simple device you can strap to your bed, and it captures your blood pressure and heart rate. So we are also a society where we have more and more longevity. So many of the elders at home are living alone or living with help, and we, the other members of the family, are working and living somewhere else. So this simple device, if strapped onto the bed, can give you an alert on your mobile that the blood pressure or the heart rate of your elderly person at home is fluctuating, and you can immediately call for help. This particular device also originated here in Maharashtra. And then we have so many more. We have iBreast, a more easy to handle portable device which can give you a mammography. And so I'm very happy here to point out that we have Dr. Reina from Korea, who has come, and she'll be speaking and talking about a portable device she has made for TB patients. So this is the kind of very cutting edge research and technology we're talking about. So Dr. Kare, what you said, I echo completely. We would like to work with you, because I think all of that energy that you have in your university, we can harness and bring about solutions closer to people where they are residing, and hope that they make a difference. So hackathon is a part of also what we do, in which we generate a lot of ideas. We involve students. So students are a very important part of Sangam, and the faculty that is teaching them is also a very important part of Sangam, because you can talk about the problem areas, and then all together we can try and resolve them. So I'm very happy to welcome you all once again to Sangam 24. And today it's a company registered in Mumbai, and we hope to continue doing our work with the support of each one of you. Thank you so much.